Hello, this is Dr. Ford Brewer with PrevMed, heart attack and stroke prevention, cancer prevention, and disability prevention. Today I'm doing a video that's a retake. I did this earlier, but I think it came across a little bit too negative and critical. It's a review of the book Fat for Fuel by Dr. Joseph Mercola. This conversation was started by a friend of mine. I was out to lunch with him a few weeks ago, and he said, "Look, I'm getting a lot of weight loss done. I'm cutting my carbohydrates," and he has. He looks great. He's probably lost at least 15 pounds over the past couple of months. He's had insulin resistance. He's going away from the carbs and into fat for fuel. He asked me if I would join him in a group in discussing this book. And here's where some of the challenge comes in. and it's the issue. I'm not going to sidestep it. I'll meet it head on, but don't want to overdo it. With Dr. Mercola, and just like with anybody, you have to watch the facts. You have to make sure that you understand the sources that are being used, and you understand what's being stated as facts and what sort of evidence is behind it. That's the problem. That's the challenge. I loved the book. One of the things that we'll have to think about, and we'll think about this with a patient that I had recently, is the overall recommendation. Dr. Mercola recommended 75 to 80% fat in the diet. Now, for some people that might be okay. But we'll talk about for some people with which that is not at all okay. But this topic is a very, very timely one. It wasn't raised by Joe Mercola. It wasn't. This is a societal dietary issue. It's a cultural issue for our diet. If you look at Time magazine, back in 1961, they had a cover picture of a fellow named Ancel Keys. Dr. Keys was a psychologist. He was the moving and driving force behind decades worth of our dietary culture that we should eat low fat. That's what, again, he had already become famous for that in 1961 when Time put him on the cover of their magazine. Well, look at this. In 2014, they're saying eat butter. Well, you know what? It looks like the pendulum has swung the other direction. And again, so if you go from low-fat diets to eat butter, that's where you get, again, more of a societal movement and push to go with fat for fuel. But again, is 75 to 80% fat healthy and safe for everyone? We'll talk about that. Before we do, I just want to mention something about one of the resources Dr. Mercola mentioned. This is a great resource for those of us who are interested in diet and aging and the science behind aging. The mitochondria, we've mentioned several times, the mitochondria is the powerhouse of the cell. Joe Mercola mentions rereading this article every few months, I think. And I can see why. There's a lot of information coming out in the hard science behind aging. And that science, the scientific research in aging right now, does appear to be focused on this issue. Macronutrients, cell respiration, mitochondria, how our cells get energy out of food, and what kind of food burns the best. You remember discussions in other videos of Walter Longo, who's doing fasting and appeared to have cured diabetes in mice with fasting episodes. Nir Barzilai, who's working with metformin, considers metformin to be an anti-aging drug. Well, you know, when you look at those two, they're actually looking at the same thing that was just in this article on mitochondria and the role of mitochondria in aging, the cell's ability to get energy out of food. With Nir Barzilai's work and Walter Longo's work, again, you got the same thing. Focus on these enzymes, these pathways, AMPK, FOXO3, mTOR, the mammalian target on rapamycin. These are all involved in glucose metabolism, they're all involved in cell respiration, and they appear to be amplified by both metformin and the fasting, as demonstrated in Walter Longo's research. So again, a lot of very interesting things going on in this area. But you remember I mentioned that high-fat diets are not for everyone. Let's talk about that for a minute. What is this? So this is a picture of an ApoE3 molecule, and this is a picture of an ApoE4 molecule. You see, it looks like it has some extra something hanging down here. And that's exactly right. If you look up ApoE4, you find out that the individuals that have ApoE4 should not be eating a high-fat diet. So why is that? Well, again, and what were those molecules that we were showing a minute ago? These lipoproteins? Well, before we get too biochemical here, let's talk about lipoproteins and do a quick reminder of what those are. In another video a few months ago, I gave you this example. This is water in a glass, and this is, I don't cook with olive oil anymore, I cook with avocado oil. This is avocado oil. It's very healthy for us, but watch what happens when I pour it into water. It forms bubbles, and then those bubbles coalesce as they bump into each other to where I end up with one very big fat bubble. If that fat bubble were that big in my bloodstream or yours, it would kill us. It would be what we call a fat embolism. And that's why we have lipoproteins. HDL, LDL are lipoproteins. LP(a) is a lipoprotein. Lipo or lipo means fat or oil, and protein means protein. So what has that got to do with this issue? Again, people that have a certain type of lipoprotein, ApoE4, have significant risk with increased fat in their diet. So, is this something new? No, actually, this is, we've known this for decades. This is some research which gets a little bit deep in terms of the details around fat in the diet and the recommendations for people with ApoE4. But as you see, the most common ApoE4 configuration is 3-4. In other words, these people got an ApoE3 from their mom and an ApoE4 from their dad. 20% of our population, or 1 in 5 of us, has that. Well, let's look over here and see what that means. Okay, a moderate fat diet for that individual increases their small, dense LDL. So, in other words, increasing fat for these individuals does greatly increase their risk for not only heart attack and stroke, but even more so for senility and dementia. Now, again, how long have we known that? This is the American Heart Association dietary recommendations from 2000. It was mentioned in there. It said, as the genetics get better, we're going to have more availability of things like ApoE4. You need to know that before you recommend a diet. Now, excuse me just a minute. And I'm going to get an illustration to again, hopefully drive home the fact that we need to first assess the situation before we decide what to do with our diet and our macronutrients. We continue to assume that there is one diet for all, that plant-based is for everybody, that low carb is for everybody, that low fat. We've assumed for decades that low fat is for everybody. And I've got many patients that are adults that have lived on low-fat diets, plant-based, for decades. I have as well. As we get older, we get more insulin resistant, and the increased carbs in a standard low-fat plant-based diet can cause problems. Because I don't think anybody would argue that increasing, once you get insulin resistance and diabetes, that carbohydrates increase your blood sugar. There are some people that would argue that point. Most of those people are not diabetic or insulin resistant and have not investigated this very clearly. As you begin to learn, very, very few people begin to argue that. The second point is, as you begin there's nobody that's going to argue the point. Increased blood sugar is dangerous. Blood sugar is 140 and above. Increased glycation and burn our tissues. I don't know anybody that's going to argue that point. But again, we have people arguing, well, you want a low-fat diet. We've done that for decades, and we've realized that that's a problem. Now the pendulum's swinging. We say, oh, no, let's go back to a high-fat diet. Think about it. 1 in 5 in our population, if they take a high-fat diet, they risk significant increase in probability of heart attack, stroke, and senility. So, could you say this is the Rosanna Dana thing where it's always something? Yes, you could. But the problem with that saying is that it's somewhat disempowering. Actually, I think it's better to say, look, first assess the situation. Make sure that you know your sources when you look for information. Make sure that you check on your sources. And make sure you understand your own genetics before you decide what kind of diet is best for you.